All right, so this is an overview of lab unit number 2. We usually do a blood pressure exercise, which obviously would involve using a blood pressure cuff and a stethoscope and sort of assessing your blood pressure and things like that, but we won't be doing that with the online lab setting. So I'll skip blood pressure, but you're welcome to sort of peruse that. Some of you may have had experience with that before. But that would have been an activity we would have done. So the focus then is going to be, as I said in my email, blood vessel identification, identifying different types of vessels, kind of like you do in the heart, where you identify a lot of different vessels of the heart, like brachiocephalic and subclavian, things like that, except this will be throughout the systemic system. Arteries and veins are the vessels you'll be identifying. And then we'll do respiratory anatomy identifications as well. So just kind of want to run through it again like I did last time, giving you an idea of kind of what to look for and how to go about studying and preparing for the next lab practical. All right, so as I said, you're welcome to sort of peruse the blood vessels and pressure lab if you like. It's all listed there for you. But again, the focus here will be on systemic arteries and veins. And so you start with systemic arteries, and kind of like we've done before, you want to focus on identifying things in the boxes. And so we'll see sort of the branching of the vessels as it works from the heart all the way out throughout the body. And that's where you start. Some of these vessels we've seen extending off the heart already, like the aortic arch and the descending aorta and the brachiocephalic and common carotid, those we saw as well in the last heart anatomy. And so that's where we're going to begin here with the systemic arteries, is the ones coming off the heart. And then you can kind of think of it as branching. Every time, for the most part, the vessels branch into another section, they get a little bit smaller, although not always, but oftentimes get a little bit smaller as they branch, and then typically take on a different name or identification. And so that's what you want to do, is just identify all the different arteries that I've listed there, and I will use an image, unlabeled image, of course, and have arrows pointing to different vessels, and you just have to identify them. So like if I use this image, you can see a lot of the vessels that are listed, like vertebral, aorta, subclavian, brachial, radial, ulnar vessels, the renal and superior mesenteric vessels, and it shows a lot of the vessels. And so I could use an image like this, except of course it would be unlabeled, and I would just have arrows pointing to the different vessels that you have to identify. Then you move on to the vessels that branch off of the subclavian, continuing off of the axillary, listed here. And you would, most likely use like a picture like this, except again, of course, it would be unlabeled. So that would be a good image to use in terms of identifying that. This image zooms in on the hand, so you could use that one to identify these different vessels. And then moving up to the brain, off of the common carotid, internal and external carotid, then of course into what's known as the circle of Willis, or cerebral arterial circle. Different vessels branch off of that, the vertebral arteries, basilar, carotids, etc. So you want to make sure you have all that. And we have some nice images here that are labeled for you to identify in this figure here. And then, of course, in the different arteries of the neck and the head, as well as inferior surface of the brain with arteries of the brain. That would be a good one to identify lots of structures. This one also shows a lateral view of a lot of those vessels going up to those arteries going up to the brain. We want to move on to the thoracic that are branching off the descending aorta. So you have those listed. And as you can see in this picture, they're labeled. You should have no trouble finding all of those. And then off of the abdominal aorta, we have several, like inferior phrenic, celiac trunk, common iliacs, so forth and so on. identifying those structures, and I've included images for you to identify those. Now, there may be one or two, again, kind of like we've done with all of these, where you may not be able to find it specifically in these, but I will most likely use these images to test you on the exam. So I just want to be familiar with all of these images and being able to identify the different vessels. Here is arteries supplying the abdominal pelvic organs. Another view of the abdominal pelvic organs. And then we move on down to, the appendages, the legs, branching off the common iliac and the external iliac, moving down things like the femoral and popliteal and the tibial. And you just work through those. And again, I've included images. Here's an anterior view, the upper leg, anterior view of the lower leg, and then a posterior view of the upper leg, posterior view of the lower leg. And you should be able to identify all those structures on those images. So again, just to summarize, I'll be using these unlabeled images with arrows pointing to the vessels, and you have to correctly identify them. Same drill for the veins, basically. We're going to start at the heart, so the superior vena cava, superior and inferior vena cava, coronary sinus, and then the veins draining off of those vessels as they go systemically throughout the body. And same thing, we have images to help you identify these structures, and you want to focus on the ones that I have listed in these boxes as labeled here. So again, it should be pretty straightforward in terms of identifying the different branches of these vessels, and you just use these images to help you identify those. So pretty much, rinse and repeat with just a different set of vessels for the veins, doing the, arms, abdominal cavity, thoracic cavity, legs, etc., and just roll through those. So here are all those listed and the images that I would be using on the exam. So here's another nice one for the abdomen and the chest. Here are the leg vessels listed in these boxes 8 and 9, and then you could use these images to identify those as well. All right, so pretty straightforward on the vessels. Just want to be well versed in identifying those. Also have a little bit of information related to the hepatic portal system, so things branching off like the splenic vein and the superior mesenteric vein, and the vessels associated with that as well. And you can see the images here for that hepatic portal system. All right, so that is it for the arteries and the veins. That'll be approximately half of the exam. The other half of the exam is going to be on respiratory anatomy. And respiratory anatomy, I have a few slides here initially that are just sort of background information. A lot of the stuff we go over in lecture. If you want to sort of review a lot of those things, that works fine. And so what we'll be doing primarily is identifying all the different components of the respiratory system. Of course, this begins with the oral cavity, that branches down through the trachea and into the lungs. And so those are the different things we want to identify. The type of tissue you see, like in the trachea, for instance, is pseudostratified ciliate columnar epithelium, which you can see in this image. And then again, the things you want to focus on, I've tried to clarify them by being the things that are outlined in these boxes here. And so the first location to start, of course, is the upper respiratory system in the nasal and oral cavities, starting with the things listed there. Here is a great picture. This will definitely be on the exam, where you can really see a lot of the structures that you're going to need to identify. Then you have the regions of the throat, the naso, oro, and laryngopharynx have different structures you want to identify. You can use that on the previous image as well. Okay. So as you move into beneath the laryngopharynx, you move on to the lower respiratory system, which begins essentially at the hyoid bone, which is the top portion of the larynx. And so we have all the different items that you want to be able to identify listed in that outline right there. And then you're going to move on and identify all these structures of the larynx. And so this is a great picture that I would use. You can see this is an anterior view, the epiglottis, the laryngeal prominence, thyroid cartilage, tracheal cartilages, cricoid cartilage, thyroid cartilages, etc. I've also included a posterior view, which is really nice because you can see, for instance, how the tracheal cartilages are U-shaped, meaning they don't connect all the way around, but you can also see the arytenoid, the vestibular ligament, the epiglottis, etc. in these pictures. And here's a really nice cross section or sagittal section through the larynx where you can identify a lot of these different cartilages as well. Now, this is a view of the glottis. And the glottis is the opening in the larynx, of course, that has vocal folds. And the epiglottis is, of course, what folds over this structure to prevent, food and drink from going down our trachea. And so this also includes vocal folds and what are called vestibular folds. And as you can see in this picture, the vocal fold is this region that is where the actual vibration of the vocal fold cord occur, and the vestibular fold is attached to that. So you want to make sure you can identify those structures in this image, and I've also have an image showing the glottis closed, where you can see the vocal folds and the vestibular fold as well. And then here's an actual photograph from a laryngoscopic view of the oropharynx and the glottis in the open position. All right, next, moving on down from the larynx is the trachea. Trachea is our windpipe and has, as I mentioned, these sort of U-shaped tracheal rings or tracheal cartilage rings, and the annular ligaments are the sort of connective soft tissues that attach the different tracheal cartilages. And then I've also included this image cross-section through the trachea in terms of what it looks like, but behind it is the esophagus. You can see really sort of the difference in the lumen between the two. The trachea passes in front and the esophagus goes behind. And we'll talk more about the esophagus when we do the lecture on the digestive system, which will be coming up in the third lab unit. All right, so that's the trachea. Here's a great picture where you can see all the different anatomical structures of the trachea and how it branches into the primary bronchi, and then it sort of like we do with the vessels, the branches of the bronchi just continue to divide and get smaller and smaller as they move into the lungs and ultimately end at the alveoli where gas exchange occurs. Here's another image in terms of that cross-sectional view of the lumen of the trachea versus compare with the esophagus. The bronchial tree is sort of what I was mentioning in terms of all the different branching that happens. This next image, you can see you want to identify all these different structures, but this next image really shows that really well. As you can see the trachea, but then you can see it branch into the primary bronchi, secondary bronchus, tertiary bronchioles, and then really they end at what are called terminal bronchiole, then a respiratory bronchiole is the next smallest, and then finally alveoli. And alveoli are just the little balls or sacs where the oxygen ultimately ends up and diffuses through the respiratory membrane into the bloodstream, the capillary at the alveoli. So that's something we'll look at more in lecture, but you want to be able to have a really good feeling for this different branching patterns in the lungs. The actual structures of the lungs themselves, pretty straightforward. Typical things like base, apex, hilum, costal surfaces, and then there's different features that you want to know between the right and left lung in terms of the number of fissures. For instance, on this picture, you can see the left lung only has two lobes, superior and inferior lobe, and then also has what's called a cardiac notch to allow or accommodate where the heart sits in the thoracic cavity. The right lung has 3 lobes, superior, middle, and inferior, and is also slightly compromised at the bottom to allow for the liver to sort of, ride up into that location on the right side. So anyway, so those are some of the images of the actual lung. So again, I would use these images to identify the different structures and fissures, etc., of the lung. So we want to be well versed in all the things listed there. All right, so that's it in terms of this lab unit. So it should be pretty straightforward, and I'll test you in a similar way we did last time in terms of using these images for the identifications. All right.